I've been looking at a sort of a new area called digital phenotyping, where the whole concept is very exciting, where the idea is to take digital traces from, say, smartphones and potentially other devices, and to link this with potentially health data, as well as kind of getting a moment by moment knowledge of what people are doing. So they might get a text message or a notification asking them to say, how are you feeling today? So the idea is to build up a really rich data set of kind of what people are doing and how they're doing throughout this time period, where we can try to help them manage conditions. So this at the moment is typically used in the mental health space, and there's a lot of work looking at how you can sort of help kind of control and sort of predict relapses in mental health conditions. However, the research is in its infancy, and I think a word of caution is indeed required with handling such sensitive types of data, as well as very vulnerable individuals. There's a lot of interest in this type of area, but the problem is this research is still in its infancy, where we don't really know how you would connect someone's smartphone use to their offline behavior. In a way, it seems like some of this research is sort of running before it can really walk. And actually, we need to kind of scale back a bit and start to think, what would, say, depression look like for an individual or a set of people? What does that look like in terms of their smartphone use? As many people have suggested, that if you're depressed, you will use your smartphone more. This is a very common narrative. But actually, when you start to really delve deeper into this, what you're probably more likely to see is that actually, if you're feeling depressed or your symptoms of depression are increasing, you might actually use your smartphone less, because it's a type of social withdrawal. So again, this completely flips the traditional technology's sort of inherently negative narrative, where you're thinking, actually, what do various symptomologies actually look like? And again, this hasn't really been done yet. So this is a really critical stage to make sure we really understand what we're trying to do.